to introduce our next speaker, Sarah Walbolt. Sarah is a PBM educator and implementation specialist. She is the host of a podcast called Let's Talk Patient Blood Management. She's a SABM member, board member. She's a surgical nurse at ProMedica in Defiance, Ohio. Sarah is highly experienced in developing patient blood management in healthcare system. She remains active in the Society for the Advancement of Patient Blood Management and is utilized as an implementation specialist to mentor healthcare organizations to establish PBM programs. Sarah serves on various SABM committees and as a board of directors. Sarah also participates in PBM Standards Committee with the AABB. Her nursing background is in gastroenterology, OR, and administrative nursing. She is fueled by a passion for bringing awareness to PBM. She enjoys patient advocacy for patient blood management and bloodless care populations. In 2022, Sarah co-developed the Let's Talk Patient Blood Management podcast to bring awareness and education of PBM. Sarah loves traveling, meeting new people, and hearing their stories. She is dedicated to lifelong learning and teaching. Sarah, welcome.
Thank you. Thank you, everyone. Good day. Today, I'm going to talk to you on the topic of the important role of podcasts and social media in contemporary bloodless medicine and PBM education, and how we can engage and educate in a digital age. And my endeavor here is to, if you have not participated in social media education, to begin to create some content. And if you are, maybe to expand how often that you are on the social media platforms. So a little bit of history of media. Media through writing and the passing down of knowledge and information dates back all the way to 3400 BCE with the Sumerian cuneiform tablets and the Egyptian hieroglyphics. Johannes Gutenberg revolutionized media when he invented the printing press in 1440. This was the first opportunity to have mass production of printed materials, and it opened up the opportunity to share news and information with many people at one time. In 1900, Tesla registered for the first patent for a radio, and suddenly people were gathered around radios to hear the latest news, to attend church services, and as a form of entertainment for their families. In 1920, the first universities began to offer courses via radio. And in the 1930s, the governments were using film industry and films to sway national allegiances. And then, of course, with the 21st century, right around the 2000 era, social media came onto the scene. And social media was a shift in that instead of the information being dispensed by a relatively few, maybe members of government or media outlets, now everyone had the ability to share knowledge and information. And now we can discuss the positive impacts and the not so positive impacts of social media, because they're definitely there. But it is a fact that social media is here to stay. And it's a very, very powerful to sway public opinion. And so we do need experts in bloodless medicine to be influential voices in the digital space. And we need medical leaders and experts to promote accurate bloodless education and to address myths that are out there. So platforms like Twitter, YouTube, LinkedIn can really amplify PBM and bloodless medicine. And I use this infographic as a sample. This infographic on social media can do more in just a couple minutes to educate a patient regarding the risks of transfusion and the symptoms that they should look for to see if they're having a reaction. This is probably better education that a patient gets bedside with a clinician when he's trying to consent them for a blood product. By sharing case studies, infographics, visual stories, it can help simplify complex topics and it can reach a broad audience. Conversations between professionals and the public enhance our credibility and foster trust with the public, which is something that's kind of on the decline. There's a digital shift in even medical education. So podcasts and social media is very powerful for delivering crucial bloodless medicine and PBM education. Podcast listening has been preferred in reading and reported in satisfaction ratings. They would rather listen to a podcast than to read a textbook. Social media also supports patient empowerment by explaining and giving knowledge to the public and patients, and it places them in a position where they can take control of their healthcare needs, and they're more likely to advocate for bloodless intervention. So why should you become involved? There's actually many reasons why you should become involved. Society is beginning to lose trust in the medical model. And the reason is they feel discontent over maybe the time they get to spend with their clinician, or they feel that their clinician is distracted. Maybe he has to be charting at the same time that he's talking to them. And so they feel like they're truly not heard. But when you engage with them on social media, it earns back some of that trust. When you look at a camera, it feels to them like you are looking them in the eye and you're focused on them and you're drawing them into a one-on-one conversation. Usually when you record a social media reel or you participate in a podcast, you're in a more relaxed setting where there's less demands on and constrictions on your time. And they can feel that difference. And just like Gutenberg's printing press, the wonderful thing about social media is you can be having these one-on-one conversations with people, multitudes at a time. You can have 1,000 conversations all at once happening simultaneously. I'm going to show you some examples of some medical and scientific social media physicians that are using social media platforms to engage an audience and to teach. And you can see here by their subscribers, how many subscribers that they have. They are reaching far more people than they can by just sitting in their office on one-to-one conversations. I'm going to show you this reel that was made by this first clinician, Dr. Karan Rajan. And I think you will find that he drives home a very important part why social media has great impact for public education. And also, it's very entertaining.
I recently posted a video about a woman who had something that looked like a pimple on her face. And it turned out to be a basal cell carcinoma, a type of skin cancer, one of the most common types of skin cancer related to sun exposure. And I made a video about how these can often look like just pimples. So if you have a pimple that's just not going away and it's there for several weeks, probably get it checked out. Because, it could be something like a skin cancer, which is easily treatable in the early stages. And I got dozens and dozens of messages after that video saying, I just got checked out and my dermatologist has picked up this cancer, this skin cancer. And for me, that was the light bulb moment. That impact you can have on 12 people, on one person even, is way more important than getting 1 million views or 10 million views. Who cares? What's the price of saving someone's life? For me, that is the underrated metric that I care about now. Every video I make, I don't really care about the views at all. Can it have an impact on someone's life? And for me, that keeps me going now. No matter even if I get 10 views.
So his last, I know it was clipped off. He says, no matter if I get 10 views, right? I don't care. If I've impacted somebody's life, if I've been able to save someone's life, that brings me fulfillment. And now I think we would all agree that we believe that bloodless medicine is a life-saving intervention. And so, if you look on this list of very wonderful clinicians, we see that there's a gap. We see that there is no bloodless medicine personality that is very heavily, in social media. So who will fill that gap? It remains to be seen, but I just wanted to let you know that the spot is open. So in the digital shift in medical education, one survey found that 88% of medical students reported listening to a medical podcast at least once a month. And it showed that the medical education through podcasts to be equivalent to traditional teaching methods. And the medical residents who participated in learning through a podcast showed improvement in their documentation skills as medical students. So it can be very powerful. Why are podcasts such great educational tools? Because they allow for listening on the go, making them ideal for very busy health professionals. Long-form content enables in-depth discussions on bloodless medicine, including patient stories, and then the expert insights from that story. They're excellent platforms for continuous professional development and public education. Physicians reported that they felt increased efficiency because podcasts allowed them to multitask. They reported using medical podcasts as for both education and for entertainment. And they perceived that the medical podcasts helped them to stay up to date and current with new literature coming out. Medical podcast education, they reported, had changed and impacted their decisions in clinical practice. So I wanted to share with you some motivating medical leaders among the bloodless care population and insight and PBM insight, and what impact we are having, but there's a lot of space for more. So this first video, and I will share it, was from Johns Hopkins University. And you can see it's a well-made video, and it has received 42,000 views. And I know that I'm preaching to the choir, and you'll know this information, but I want you to see how in a very short 2-minute video, you can be offering alternatives in various spaces to the public.
Every year in the U.S., patients receive 21 million blood transfusions. What if there was a better solution with significantly improved outcomes?
So nearly every surgical procedure involves some degree of blood loss. And traditionally, we give patients blood from the blood bank. However, another option exists, which is called bloodless medicine surgery, where we use alternatives to transfusion.
Techniques performed before, during, and after surgery result in faster recovery, fewer infections, and quicker discharge. Bloodless medicine eliminates the need for blood transfusion, thus avoiding the dangers of allergic reaction, contamination, and the possibility of receiving the wrong blood type. Before surgery, medication and nutritional supplements increase hemoglobin levels, which help your body handle blood loss during surgery. A process called hemodilution temporarily replaces a portion of the patient's blood with fluids, lessening the impact of blood loss during surgery. Tools and techniques used during surgery include anesthesia processes to safely lower blood pressure. Harmonic scalpels clot the blood while cutting the tissue. Cell salvage machines collect lost blood, wash it, and return it to the patient. Hemoglobin monitors reduce the need to collect blood samples to be sent to the lab. After surgery, medications and techniques can minimize bleeding and improve oxygen in the blood. Often after surgery, blood must be drawn to run follow-up testing in the lab. Microsampling requires 1/10 the amount of blood traditionally drawn, reducing the amount of blood patients lose by almost 90%. At Johns Hopkins, our team of highly trained experts have been providing patients alternatives and peace of mind for years.
I think you can see that that was a very well put together 2-minute video that gives patients and the public an alternative option. And just the visualization of the microsampling really brought home and showed in pictures the message. We also had Dr. Usoro visit our podcast, and the podcast was celebrating the science and the history of bloodless medicine. And you'll see that it received well over 800 views on our YouTube channel, and it performed very well on our audio platforms as well. And it has actually been one of our highest watched and listened to downloaded videos. It's a 30-minute video, so I won't share it with you here today. I also wanted to share this video of Sherry Ozawa, because Sherry, in a very short reel, shared her own personal experience, and that is really beneficial to the public.
I'm a mom of 4 kids. About 10 years ago, I had to have surgery myself. Did my preoperative testing to find out that I had a hemoglobin of 7. It was ironic, right? Because I've been doing something related to patient blood management and blood health for almost 30 years. I myself had heavy menstrual bleeding, but didn't know it was heavy because I didn't have anything really to compare it to. I feel like there's days and years even I missed out on things that I could have with my kids, with my own brain, with my own emotional health, mental health. And it was astonishing to get that intravenous iron. I absolutely physically and psychologically felt better immediately. You know, I don't sell intravenous iron for a living. It was what I needed. I was iron deficient, tremendously iron deficient. And I spent decades counseling patients about exactly those reasons. And yet, as a woman, completely overlooked it in myself for years.
You can see that that has been shown well over 22,000 views and downloads. And Dr. Shander, with one of his trailers of our podcast, over 6,000 views. So we can have impact in the digital space. So I want to share with you some practical tips if I've convinced you to kind of engage in social media. Sorry, let me try to go backwards here if I can figure out how to go backwards. Almost done. So. Okay, so practical tips. It's not named. Okay. Practical tips for getting started. You can start by creating a profile on key platforms like LinkedIn, Twitter, whatever social media platforms you're most familiar with. And then you can create your own educational content. And really, the shorter, the better. If you can teach one point in 1 minute, you'll have much more success than long videos. You can create your own educational content, or you can help expand the content that you find online. Someone's made a very good piece of content, make sure to forward that on your social media platforms. It reaches a broader audience. And think about starting a bloodless medicine podcast or offering to be interviewed on bloodless related podcasts. So let's say your specialty is anesthesia. Offer yourself up, reach out to that podcast creator and say, hey, I work in the anesthesia field and I practice patient blood management. I'd like to talk about the benefits of patient blood management and bloodless medicine. So wherever you can get an in, women's health, whatever, reach out to those content creators and say, I have new research. I would like to share it with you and how the benefits of bloodless medicine. So it doesn't have to be a bloodless medicine podcast or a PBM podcast. But if you do have something new and interesting going on, if you have a story to tell, podcast content creators are always looking for engaging stories. There are charlatans out there on social media, right? We already discussed that there's good and there's bad advice, and bad advice can spread quickly and it can cause harm to outcomes. So I wanted to give a cautionary word of advice that make sure that if you're going to forward on information on bloodless medicine or patient blood management, that it is backed by research, and that it peer-reviewed studies and verified medical experts really makes our trust value package worth it out on the digital space. So we don't want to be causing harm. We want to be giving accurate and reliable information. I just want to say thank you for all of the clinicians and the experts who have taken time in our first 2 years of podcasting to come in, tell their stories, tell their expertise, tell the world why it's important. We couldn't have a podcast without people volunteering and stepping up and spending time with us. And just would like to say thank you very much. And if you ever want to reach out to us for more direction, we would be more than happy to get you started or to help you out in your social media efforts when it comes to bloodless medicine. Thank you.